regrets, but are looking forward. Thank you, Carrie. Already heard from some people who are looking forward to the recording. So just to let you know, today we have a report from the New Mexico Chronic Disease Council. They have just recently completed or are working on a health equity survey, and they're going to let us know how that is going. So again, please introduce yourself in the chat, your name and affiliation, whatever it is at the moment. And very shortly, we'll give people a little more time, and then we will turn it over to our presenters. So I'm going to stop sharing here. And who do we have here? Sankirtana, is your team here?
Let's see. I don't see.
I don't see Sophie.
Yeah, so let me just check my email and see if she's having any difficulty getting in.
Okay, thank you. Meanwhile, we'll just keep admitting people. Hi, everybody. Seeing familiar faces, new people, perhaps.
I just admitted as Sophie, so I think that's her.
That's who we were looking for. Thank you, Carrie. It's
Elba say that she's running just a tad behind and will be joining shortly. So I'm not sure if we might want to give it a minute or just get started.
It's you're the team. It is only 1 minute past. How about we give it another minute? And then Sankirtana, are you able to just take over the reins and tell us all about your work while we wait for Sophie, or do you want to wait for Sophie? What's your pleasure?
I'm
here now.
Sophie.
Oh, there's Sophie. Hi, Sophie. Okay, looks like people are still coming in, but we'll keep an eye on newbies. Let's give them 1 more minute for people to come on. And we do have a little bit of business ahead of time. So why don't I do that? I'm going to go back and share my screen again. Welcome everybody to our Health Council Talk presentation by the New Mexico Chronic Disease Council on their Health Equity Survey. We want to get started, as always, with our Alliance land acknowledgement. So we here at the New Mexico Alliance of Health Councils humbly recognize and acknowledge that we are on the unceded territory and the ancestral lands of the original peoples of New Mexico's Pueblos, Apache Nation, and the Navajo Nation. And together we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities, while at the same time strengthening and respecting our relationships with Indigenous people. We give thanks to the past, present, and future stewards of this land. We respect all tribal nation sovereignty. And in offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of the New Mexico tribes and nations who are still here with us today and to whom we pledge our support. Thank you all. Okay, so team from Chronic Disease Council, we're going to turn it over to you and let you introduce yourselves and the work that you're doing to our Health Council members and other people who are on this call. Take it away.
I can start. Hi all, my name is Sophie Rouge. I'm the Community Events Coordinator for the Chronic Disease Prevention Council. I basically help support all their work groups, one of which being the Health Equity Work Group, which we will talk about today. I'm really excited to introduce Sankirtana Donner, who is one of the co-chairs of the work group. And Sankirtana, I'll let you introduce yourself.
Thanks, Sophie, and thank you everybody for making time for us. Can everybody hear me okay? Okay, great. Sometimes it's a little quiet. So again, my name is Sankirtana Donner, and I'm the Director of Health and Social Equity with Presbyterian Health Plan. Some of you I've met and know that I started with the health plan in this role October 2022, so I'm still fairly new. And around the same time started as co-chair of the Health Equity Work Group and with the Chronic Disease Prevention Council, and excited to be here today. I'm going to take a look at the screen to see if Elba's here. I don't think so. So Sophie, I'll turn it back to you.
Awesome. And when she does hop on, Elba is one of the other co-chairs. We can introduce her when she's able to make it. All right, can everybody see my screen?
We can see it.
Awesome.
Yes, we can.
All right. So the Chronic Disease Prevention Council is a multidisciplinary body of experts, basically seeking to reduce the burden of chronic disease throughout the state of New Mexico. We create a forum for collaboration and communication to break down disease-specific silos and focus on prevention and control for issues of cancer, diabetes, heart disease, stroke, and diseases related to tobacco use. Our core principles are advocating for prevention policies and programs, facilitating collaboration among agencies and organizations working to prevent or manage chronic diseases, and supporting initiatives to understand, identify, and address social determinants that impact chronic diseases. One of the great things about CDPC is that we increase our capacity by collaborating with other organizations. So even though CDPC itself is a little bit smaller, we collaborate with other orgs throughout the state, so we can help as many people as possible that way. So one of the work groups that we have is the Health Equity Work Group. And the Health Equity Work Group explores the public health role in advancing health equity, with racial equity as a major priority and community engagement as a central strategy. So these are the Health Equity Work Group purpose areas. So we focus on education, collaboration, and advocacy. So we're part of a systems change with advocacy and influencing policy. How do we influence funding and support moves towards better reducing inequities, operationalize health equity to make it real, not just walk the walk, but actually talk the talk. Provide further awareness and education to other entities and partners, speak and share a common language, put a needed spotlight on health equity within public health, and improve health literacy in the language of healthcare. So one of the projects of the Health Equity Work Group was to create a survey. And so the survey was basically used to assess organizations' level of health equity integration within their programs and internally. The survey is still active, and you're welcome to take the survey at the end, but these are the organizations who have participated in the survey so far. The survey is anonymous, but there is a place where you can list your organizational affiliation. So these are the questions on the survey. So how would you describe your position? What are the challenges that you encounter regarding health disparities? How would you describe your current work in health equity? What do you need that would help you increase health equity? So these are the preliminary results of the survey. So thank you, Sankirtan, for putting this together. So many of the challenges identified involve transportation access, funding for hiring more navigators and community health workers, oral health access, and insurance. Successes identified were training on unconscious bias, implicit bias, microaggressions, and the impact on health, vaccination efforts through collaboration, data collection for oral health needs, establishing relationships and partnerships collaboratively, addressing health concerns in tribal communities. Let you read the rest of the slide. All right, I'm going to move on. So basically our next steps are we want to continue collecting data and distribute the survey as widely as we can to get more responses, because more data is better. And we would love to hear your feedback and discuss, how you're implementing health equity within your work and within your organization. And if you're interested in joining the Health Equity Work Group, please drop your email in the chat and I will go ahead and send you an email invitation. I'm going to put a link to the survey also in the chat if you're interested in taking it.
Thanks so much, Sophie. And can I add a couple of things briefly?
You have the rest of the time, so it's all yours.
Yeah. So, part of what I know that there's surveys all over, surveys, assessments. People have sometimes a lot of survey fatigue with these sort of things. This was something really short to kind of, in a qualitative way, get a quick and easy look at kind of like what's important to folks out there across all different types of organizations. And that is going to hopefully help us hone in on our priorities for this coming year, because we really want to be sure that in the health equity work group, our work is responding to what people would like to prioritize. What are areas where they might want some more training and education, and we could have some like a session around that, or if there's some kind of group discussion that people would find beneficial to help share ideas. We want to be really sure that it's responsive to that. So that's one of the main reasons why we are hoping to get the survey out and sort of get a lay of the land so we can be responsive.
Team, do you have more that how you'd like to use this time? We have a lot of health councils here, as I think everyone here knows. All of you health council people, you each have a health equity committee, correct? So it sounds like this is a good project to partner in on. I'm quite sure that the Chronic Disease Council would like to hear what you have discovered in your work with your health equity committees. And Sophie, I'm wondering if you can't put that slide up again about the results, and maybe we can get some feedback from our health councils on what they've experienced also.
Yes, give me 1 second.
It's really neat that we're seeing a lot of interest in the chat. A lot of people are dropping their emails, and that's really good.
Right, yes, and we will send those along to all of you, to your team. So here we have some preliminary results. You all want to take a look at those and let us know, let this team know what resonates with you. Are you finding similar challenges? Do you have successes to share, initiatives? Are there some resources that we could put together to help advance health equity in New Mexico working together, and what might those be? Why don't we just open the mic? Challenges, folks in health councils? Do these sound familiar?
I can add a little bit to that if you don't mind. This is Pamela Skinner with the Community Wellness Council, Valencia. And that is one of our biggest challenges, is the transportation, because we have no public transportation. I'm sure all the other rural areas are suffering from the same thing, but the majority of our clientele and people that we want to try to access, they have no way of coming down off the hills or surrounding areas that are so far away. So transportation is definitely a challenge, and I am trying to work on it. But it's so hard in a rural area to get a bus or some sort of transportation at all.
Mm-hmm. Pamela, what are you trying?
Well, I have met with Rio Metro, which is one of the little buses, the only form of transportation that we actually have here that resembles like a taxi or a bus service or anything like that. And I've also met with United Way, because I want them to help me to put bus stops. I think if we could have like designated areas where people could go, and I could get Rio Metro to run like just a route, like one standard route every day or twice a day, or, coming, going. If I could just get one standard route that they could commit to. Right now, in order to access their services, you have to call and make an appointment, and then they go pick you up. It's a call-in thing. I want something where people know if I'm at this area at this certain time, these people are going to come and get me. So I can get down off the hill, or I can get from the other side of town into town where the services are, and know that it's going to be there to take me back home. See what I'm saying? I need designated stops and designated times that are there every day. Not, oh, can you call me and come and get me?
Mhm. Mhm.
So that's what I'm working on over here in this area. Wish me luck.
Yes,
I'm gonna need
yes,
it.
Pamela. More than luck, encouragement. Let's give Pamela
you.
some encouragement.
I could ask a
Thank you
follow-up
all.
question because this is such good feedback. What have you found so far in those conversations that has, been hopeful to you in terms of getting that accomplished, or what has been, kind of like a barrier or worry that could be?
It's tough because one, the main road that goes through our town is owned by the state. It's a state highway. So we have to coordinate everything. We have to coordinate with the village, we have to coordinate with the county, we have to coordinate with Rio Metro, and we have to coordinate with the state. And I'm not asking for anything major or big. I'm just asking for one bus. They look like big vans. They look like a big van type bus thing. And so it's getting all of them to agree, and then finding the funding and having the designated area. They literally have one little tiny sign down the road here where and it's right, believe it or not, it's right near the village offices, the main offices for the village of Las Vegas. I almost hit the bus one day driving down Main Street because there's nothing to tell us that there's a bus stop there or they're going to stop. And I don't think it's timed. I think that if there's somebody standing out there, they stop. So we have, us as people driving back and forth, we have nothing to warn us or tell us other than this bus that decides, okay, I'm going to stop and pull over because I see somebody. I want regulated. I want stops. So like I said, that's my one of my goals here. I'm working on it because we are lacking transportation over here. Something terrible. Thank you. I'm sorry.
The United Way you're working with is the United Way of Central New Mexico?
But they just changed their name.
Oh, they just
North
changed
something Central. Yeah, that's them. And I just spoke with them again just the other day. I ran into a couple of them at a meeting we had over here. I said, don't forget me. I work bus stops.
Mhm. Great, thank you.
Well, Pamela, you're barking up the right tree because Rio Metro about 8 years ago had a big community splash in Valencia about what do you need? And we were all like flower routes, meaning, the routes that go to the outlying areas.
Yes.
Back to the hub, because they magically find the money for the population centers, right? So that's pretty well served. It's not great, but at least there are little tiny routes in the population centers. But for the folks that live outside of that, it is just good luck and call in and plan 4 days in advance. Well, my family lives out there, and that my family member does not plan 20 minutes from now. So 4 days from now, or even if it's over a weekend is when they really have to plan for Monday. It's a non-starter. So I am with you, and I think bus stops that look like bus stops and pullouts where the bus can tuck in are a lot safer for everybody involved. So good job, Pam. You're doing the right thing.
I figured when I told these people when I came back, I said, you're going to get tired of me. Thank you all.
Persistence. Nevertheless, she persisted. Good for you. Anyone else got a challenge and or answers to the questions? Is that what you're suggesting, perhaps? We just switch slides here.
That was my bad.
Oh, okay. Any other challenges, successes, recommendations? How can we work together, especially? Got a great group here with lots of good ideas, so let's hear some.
We got 6 bottles of hazelnut and only 20 bottles.
Come on, folks, don't be shy. We're gonna start calling on people in a minute.
The vanilla's in good spot. Hazelnut, yeah, there's 6 bottles.
I think I saw Shay. I know you have a transportation problem in Catron County.
Yes, we do have a very substantial one, of course, with not having any hospitals in the county whatsoever. And everybody basically for healthcare has to go to Arizona. We do have our senior center that offers rides to appointments and such. But again, that's something that you have to set up a few days in advance and plan it. And that's very tough if something spur of the moment happens.
Mhm. Mhm.
But we have discussed possibly getting another van for the senior centers to at least aid in some of that.
Mhm. How about those of you that are working with navigators and community health workers? How's that working out? Anybody? Doña Ana County, I know you're working on a project with community health workers. What's happening down there? Who's here from Doña Ana County? I saw somebody.
It's me, Wendy. Hi.
Hi.
I actually, let's see, our health council is we just are in the process of forming a subcommittee for the community health worker grant. That grant is Agentes de Cambio. And they are, like I said, they're in the process. They'll be having their first meeting on March 9th, and they're in the process of forming that subcommittee to get community health workers in their businesses. They've really tried to target businesses and other organizations around the county so that they can show them the importance of what having a community health worker at their place of business, the impact that it could have.
Mhm.
Wendy, I also, if I could see that Elba has joined us, so maybe we could do a quick break. People can think for a little bit about anything else
Okay.
to add, maybe while Elba, if you'd like to introduce yourself.
Hello, excuse me. I apologize for being a little late. I was getting off another meeting, but it's wonderful to be here. Thank you for giving us this time to talk about our committee. My name is Elba Saavedra Ferrer, and I'm a co-founder and also program director of the Comadre program, which provides navigation, education, and emotional support to Hispanic Latinx in the state, and funded by the Department of Health and actually United Way and other entities to enhance breast cancer outcomes and address the health inequity. So glad to be here, and thank you.
Mhm. So team, how can this group help you with your project? How can we work together with you on health equity?
I think you're talking to our team, right, Wendy?
Yes,
Yeah.
Sophie, yeah.
Yeah, and I think one really great start here is thank you so much to everybody for putting emails in the chat for potentially joining the health equity work group. I think that would be really wonderful. Again, I know that people, not just with surveys, but also with different meetings and things like that, there's a lot going on. So we want to be really sure that the time that we spend together is purposeful, and we'll certainly reach out and would love to collaborate with everybody that's doing this wonderful work locally to kind of plan for the year and make sure that we have a good forum to address the issues that are important to you all. Sophie and Elba, what are anything else you want to add about how best folks can support?
Jump in, Sophie. I think just even allowing us to present and to talk about our efforts is just wonderful. I think that collaboration and the partnership, it's so important in New Mexico, right? We all know that. A lot of us that have worked with other organizations, you just cannot do anything really on your own. You really need to collaborate, need to come out of your, and not only your area, but it's also incredibly important because you learn so much, right? That multidisciplinary, that the lens, different lens sees different things. And I can't tell you, for me, that's so exciting. So I look forward to having you, some of us join, some of you join in on our committee and try it out. This is a great time, as our team knows, because we're reviewing a lot of our new direction in this coming year, and still with our survey, again, disseminating that, right? And so continue to also send out that link. And do we have that link, Sophie? Yeah, on the chat. Okay. So thank you so much. And yeah, join in, and anything I or our committee could do, either individually with organizations, please reach out. So thank you.
Could you post the survey link, but also an email for how people can get in touch with you if they'd like to learn more? Put that in the chat for us. That'd be great. Oh, let's see. What is this, Sophie, that you just put in the chat?
It's the survey link.
That's the link to the survey. Okay, great. So if one or more of you could put your emails in, that'd be good too, and we can get in touch with you.
That'd be fantastic. Thank you.
Elba, I actually remember encountering you when you were talking about comadre.
Yes.
I think many of our health councils have chronic disease as a health priority. Could you just take a few minutes and talk about the Chronic Disease Council and what you do?
Sure.
And your program, Elba.
Well, okay. Yeah, I put it in there. Okay. Let's see. You can hear me? Yes. I'm always looking at the mic. Sometimes I don't turn it on. Yeah, so as our team that's explained here, again, we're working on inviting organizations in terms of the Health Equity Committee to really, this year is very exciting, but even our accomplishments last year is to develop the survey. And I don't know, Sophie, did you get a chance to talk about the infographic for mental health?
No, we presented that at a previous.
Oh, good. Okay. Awesome. So that, which I think we're so excited about that as well. So just really, working together. I know all of us, right, have health equity and in our agenda, somehow integrated in our own work and our organizations, but being able to come together and to pull together those resources, ideas, and as it was mentioned, making purposeful the meetings. So those projects resulted in that. And this year we're looking at our agenda to address those, a more, focused project and getting ideas. So we're excited about that as well.
And could you tell us a little bit more though about the Chronic Health Disease Council at large?
Oh, so I'm going to defer that to Laurel and others, because Laurel has more information about the full breadth of it. I know I co-chair with our co-chair team here. Any of you want to jump in? I'd be glad to talk about Comadre as well. So.
Okay.
Yeah, Sophie, if you'd like to share that slide that you had that has the overview, maybe you can say a little bit more about it.
Yeah, absolutely. Give me 1 second. But yeah, CDPC actually has multiple work groups that work in different areas of chronic disease prevention. So we have a heart disease and stroke work group as well. I know Cheryl Wilkeson is on the call, and she is actually one of the chairs of that work group. I know I put you on the spot, Cheryl, but if you wanted to talk about that at all, please feel free to.
Sure, you caught me eating lunch, sorry. Yes, I am quite honored to be the co-chair along with Jessica Oceanberger, and I can never pronounce her last name as well as she can, so please forgive me. I know she has lots of friends on this call. But we are the co-chairs of the Heart Disease and Stroke Group, one of the work groups, along with the health equity. I think each one of us work groups kind of take a key priority or a pillar, as you might say, that impact chronic disease and health over our state. And so we work with bringing together, convening other people that are working in the same area. So for the Heart Disease and Stroke Group, our top 3 priorities are much like doing a survey. We is on nutrition security, hypertension or chronic disease management, specifically hypertension, and then tobacco and vaping and how it impacts. We do a stroke awareness program as well, and we're also looking for members, so those that are interested in that definitely join. We're kind of in the same phase as trying to really get down to who we are and what is the tangible impact that we'd like to make. But yes, we have wonderful partners that are other work groups that support the overall mission of the Chronic Disease Prevention Council.
Great, Cheryl. Would you like to put your email in the chat so people can get a hold of you if they want to join your committee?
Sure, will do. Thank you.
Well, any other questions, comments from our group here, our big group? Questions for the Chronic Disease Council or input for them at this point in time?
Wendy, this is Chris. It was Elba talking that kind of reminded me of something, and I'm wondering, I brought it up one time with the health councils, and I don't know, I'm wondering if it might be something to just ask in some meeting as to whether the health councils might, try to find someone willing to be kind of the designated like communications person. And by that, I don't mean somebody who has to do like the newsletter and everything else, but to perhaps respond to requests from the community sometimes for information. One of the things that the Health Equity Committee did, I think Elba remind me, was put out a survey at one time asking organizations what they did in the area of health equity. And I had recommended that it be sent to all the health councils for that. And I do know there's a survey going around right now from OSAB around substance abuse. So there are things like this that one would hope the health councils might respond to. But I have the feeling that there's been a very limited response on those kinds of things. And I just wondered if at some point we might bring it up with the health councils if they just kind of want to think about how to respond to those kinds of needs for information.
Well, how about this as a suggestion, though, as it was noted earlier today, health councils get a lot of requests to fill out surveys. Perhaps we can implore those who are fielding surveys to try to connect with other people who have sent out surveys so that we can put together all those responses and work together in terms of collecting information. What do you think, health councils? Would that be, could you, like, when you get a survey, could you let the Alliance know that you're getting a survey, whether or not you have the ability to respond? And maybe we can start encouraging people to gather information together. What do you think? Thank you, Cheryl.
I love that idea.
Okay.
Anything to kind of collate those surveys together. Otherwise, we're spending all our time doing them.
Right. So Chris, I heard you reference a survey. Was that being done out of Bernalillo County? Do you still have those results? Do you want to share them? That's not now, but at some point in time. Yeah, and you're muted.
No, I think right now, I think all of you are going to see it, and Diana Good just also put it out there. The OSAP survey around substance abuse is, it's a statewide survey, I guess, but there'll be a lot of different people asking for that. So the health councils may get that. In fact, I got it first because the Torrance Health Council sent it to me. The other one I was talking about, it was the Chronic Disease Prevention Council, their health equity committee.
Chris, that's who we're hearing from today.
Right. No,
Yeah.
I know Elba and all that.
Okay.
And at one time, I think last year, we had tried to send out the survey that they had asking different groups in the county, I'm sorry, in the state, what they did in terms of health equity to kind of have a, a consolidation or at least a resource of all the organizations that did that. And I'm not sure, Elma, you might know, I'm not sure how much of a response we got from the health councils. So, and it was put in the newsletter from the Alliance also.
Yeah.
But
let me
any
jump-
suggestion is good. Sorry.
Let me jump in here. Maybe Sophie and Laurel could help because I know this was a while back, but I think when I came in on board, Chris, that there was already some discussion about, and I don't recall that it was a survey, but I could be wrong because I was just coming on board, that it was more of a resource list or a list that had been pulled together, but I don't recall. And I think that's one of the reasons why in the committee that I was working with, we started to actually think about whether we wanted to reach out to organizations with a sort of standardized same questions about how they saw their work in health equity and how do they see it, what are their gaps, which is what you heard today being presented, some of what's already been collected that Sophie presented. So I think that, but you're right, and again this speaks to how we all whether that and again I was just coming in at that time. I think one of the things that we saw, and I list, and correct me if I'm wrong, Chris, but I think that at the larger, not the individual committee meetings, but just reflecting on some of the organizations and acknowledging that there were numerous organizations working in the area of health equity. For example, for Comadre, that's our primary work. That's why when we co-founded, and by the way, this year is our 20 years, which is unbelievable to me. I look at my grandkids and that's how I can tell, because I'm like, wow, time has gone by, because they were little ones. But co-founding that, and of course there's always evaluation and research aspect of that, but we've learned a lot. But one of the things that has, the whole focus of that was to address these inequities in screening among Hispanic Latinx, which constantly, as we've seen the reports over the years, the American Cancer Society keeps, us very well informed on how there's still a huge delay in not so much the incidence, but in the follow-up. And so, really, when you think of cervical cancer, for example, being so preventable, unlike a lot of other cancers, the fact that any woman, and that's not just Hispanic Latinx, but any individual should die from that, or get diagnosed at a late stage is really, worrisome, because we have such great tools. So part of our work has been addressing screening, addressing lack of medical insurance, no medical insurance for a population that we work with is monolingual Spanish speakers, primarily uninsured, almost 85% of those that we work with. So the issue of being screened or even being diagnosed with breast cancer is the first thing that's, worrisome is, I don't have medical insurance. What am I going to do now? Right. So again, and then other organizations that have been doing work in this area of health equity. And now it's wonderful to see how organizations moving forward have dedicated, right? Just like the chronic diseases specific task force or committees to address, together. And I think that's the part that I love is that, yes, we're all doing our individual work, but let's utilize and build on each of our experts to come together and enhance, even broader the area of health equity by coming together and developing concrete projects, right? And again, smart objectives, right? Something that we can implement, something we can develop, see through it and develop it and implement it, and that it's useful and productive, not just to meet for meeting's sake, like someone in our team said, we've talked a lot about that. So hopefully going forward, but yes, Chris, it does build on, acknowledging that early on, understanding that there were organizations that had been doing work in health equity. Yeah. So I don't know if that clarified or helped, but anyone else feel free to.
I heard you say, yes, come together to gather information. And also I like this, come together to work together on some smart projects, I think you call them. So great suggestion. Let's get some ideas on how to do this. I want to point out that you have the Alliance staff are on this call. There are people from DOH Health Promotion on this call. And they're all of you from health councils and the community on this call. Anybody have some specific recommendations for how we all work together on moving toward health equity? Let's just do some brief brainstorming here and get some next steps going. What do you think? How are we going to do this? Come on, folks. Got to start calling on people. Health promotion. Diana, Chris, what can you do to help us here?
I was filling out the survey.
You're filling out the survey. Great. Okay.
Oddly, no. No, I think giving our voice to, not that we speak for community, I think that's not great either, but that we at least speak up when asked, for what's going well, what's difficult. I personally am on my soapbox on the survey, going on and on about how we really need to get everybody in state government and of course agencies. I think agencies are a lot more nimble about this, but we need to get state government on board with really fixing the culture of language that we use with folks. And it's not just one population. Staff, it's just a constant uptraining and retraining and remembering that we don't know the current language. Most of us are about 5 years behind, and that's me included. And so to get current with what the kind way to speak about and to people is, and I just know we're causing harm, and that's a health equity issue for me. We're not taking that on as a practice that's just as important as feeding people. It's just as important as giving needles, but it's the how we do it, which makes people want to come back and trust us. And I'm feeling it today. So, and that's a personal thing too. We actually take the trainings that come across our screens or our awareness, that to really continue that education process and not think that we know it all because we've been around for a little bit. I was reminded of that this morning. So, and it's not just about language in terms of language spoken or language heard or language written. It's about actual tone and body language and how we are with people. And it's how we are with each other in these meetings. And whether or not we're multitasking, I just did it and was caught off guard. So my apologies. I don't know if that answered your question, but that's what I'm taking for my today to-do list on my accountability side.
Yes, I'm making a checklist here. I'm hearing we can work together on information gathering. Maybe we should all adopt this survey and send it out and get people to fill out this particular survey if we like it, or some modification perhaps of it. I heard you, Diana, say training. We all need to commit to being educated about what health equity is, what it is in New Mexico, where we want to go with this and how we're going to get there. I heard you talk about communication, and Chris also communication. How do we talk about it, and how do we talk about it and to people about it? What are the words we're using, maybe the images we're using, the way we're framing the whole issue? So I'm seeing an agenda develop here. And who have we got on staff here from the Alliance? Carrie, are you still here? Where's Carrie? Yes, Carrie.
here.
Carrie is our communications person. And I also want to let you know that we are developing an online searchable library of resources. And one of the categories of that library is equity. So resources to further health equity in New Mexico. So what we can do here at the Alliance is Carrie can work with everyone on communication. We can offer our library. If you have resources that you want people to have access to, please send them our way, and we'll make sure that people can get access to tried and true resources. So not just everything under the sun, but what has worked for you in terms of furthering health equity in New Mexico. So those are things that the Alliance can pledge to do, I think. How about you, health councils? You see a role for you in this?
Wendy, one quick thing, because you just said this was something the Alliance can do, and now we're asking the health councils. And so this, my thought goes to both. In a couple of meetings or something like this session a little while ago, Anne had brought up the concept of having peer learning sessions.
Yes.
Or peer groups. And one of the ones we had thought about was communication. And I would really like to urge, and I'm quite willing to work with Carrie, to kind of set one up and maybe get something started. But in this case, I mean, my view of it would be as a kind of a user-friendly spot for everyone to kind of share some thoughts, not as a kind of a training, but that, you know, we might pick some areas of communication that people have, you know, questions about. And believe me, that can be very broad. But I would love to see, you know, the Alliance. And as I said to you, I'd be quite willing to work with Carrie to start setting something up and getting people involved. But I think that would be, you know, great.
Thank you, Chris. That does remind me that we do have an intern working on developing a platform for peer learning. And he's testing it out with his fellow interns at the moment to see how it works. But yes, if you are interested in helping us set up peer learning groups, so they're kind of like Facebook groups, only better, let us know. And I see a couple hands just went up. So Linda and then Diana.
Hi, Wendy. Hi, everyone. I'm Linda Atencio, and I work for United Healthcare, and I work with the Community and State Division, which is health equity and Medicaid. And my job here in New Mexico is to learn what's going on. And I thank all of you for all the contributions. Every time I'm on these committees, I learn new things. And you are the people that I look to learn about New Mexico. And so thank you. As a health plan and a potential MCO for the state Medicaid program, we have bid on that. I really appreciate what you do. And if anyone wants to have any individual discussions, I am the person that you would contact for that. And so again, we're trying to learn from you instead of coming in, and I'm born and raised in New Mexico. So the first thing I told United Healthcare is we don't need to tell anybody what to do. We need to learn what they need and let them tell us what they need. And so that's from the standpoint that I meet with our community partners. So again, very excited about always participating in these sessions. And if anyone wants to contact me and have individual conversations, I would love that. Thank you.
Great. And you'll put your email in the chat, right, Linda?
did. Yes, I do every time, just in case somebody,
Right, put it in again. Put it in again.
somebody reaches out. Thank you.
Great. Thank you, Linda. Great resources here with our MCOs and our healthcare plans. Diana, got your hand up?
I actually have a question for health councils. Really kind of remembering a couple of things past and recent, but I'm wondering if health council coordinators, staff, whatever they're called, would be interested in some detailed skill building around how to deal with public comments that are extremely harmful and stigmatizing in the moment, because that is a tough skill to do. It can cause interpersonal strain within health councils and members, but I know it still happens. Those people are the reason for all our problems. That stuff is still happening, and I know that it's really a hard moment to be in as a facilitator or even a meeting, just a representative of a health council. Like who's got the courage to say something, and how do you do that kindly so that we don't lose valuable people that have been around forever trying to do really good things. Their hearts are in the right place. But I would really like to know from health councils what that looks like, or what it might look like for you, and if that would be helpful.
Great, Diana. Put your name in the chat again. Okay, so people can get a hold of you. And I want to get a hold of you too, because it sounds like a good peer learning group. And Shay, I see your hand.
Yes, actually, I love that idea, Diana. We struggle here, of course, being such a small community, that people don't like people for this reason or that reason, and there's a lot of distrust, and learning better ways to work around that or deal with that, I think would be amazing, and I would 100% be involved.
Okay. Diana, make sure you have Shay's email. Great. Oh, a lot of work to do, and we have to do it together. So thank you, Chronic Disease Council, for being the impetus to quite a lively discussion here. Let's not let it drop. There are a lot of people on this call that are working toward this goal. Let's try to figure out ways we can work together, collecting information, educating ourselves, sharing ideas, challenges and successes. We'll try to put together in the notes for this meeting, we'll try to capture a lot of this good information and links that have been mentioned today. So check back with us sometime next week. We'll try to put it together. But meanwhile, check your comments, your chat box, and pull down those emails of people you particularly want to get in touch with right away. And also, one more time, chronic disease folks, could you put the link to the survey into the chat? One more time.
Yes.
Take a look at that survey, not only to fill it out, but also let's see if we can't invite other people to forward this survey to their networks if we think it's going to serve our joint collaborative purposes. So take a look at that survey, hopefully fill it out, and give these folks some feedback, and us too, some feedback on this survey. Any other comments, questions, suggestions from our group today?
I actually do have a question, and Shay, you might be able to answer this, or anybody else. Like, when you think about that kind of skill building, would you want that to be like one-on-one or in a group setting? Because I can imagine that Zoom experience kind of loses the practice ability or the practicum part. It's easy to just sit back and not learn, or sit back and not practice, and really do the hard pieces of that. Would you rather that be super intensive, almost one-to-one, or in a group setting?
Or maybe in person?
Yeah, that's what I mean.
With
like,
some role playing. Mm-hmm.
Yeah.
I do love the idea of in person, although, and I think if it was kept to a small group, it would be still very effective. In a meeting with maybe 35 people or something, then I would be afraid it would lose something.
Yeah.
Yeah.
even 30 is not good in-person numbers like that.
Right.
There's fidelity issues around training protocols, but yeah, I'm definitely willing to develop something somehow, maybe in, with the Alliance as a host, maybe, just because, it's a statewide thing, and it's a statewide issue, and we keep stepping on ourselves and foot and mouths, it's all over the place over and over again. Mostly this training is for me.
Right. Learning while training. Yes.
Yeah.
And I'd be more than willing to help you in any way with that.
Okay.
Excellent. Excellent. Thank you. And Diana reminds me that the Alliance and the Health Promotion team are working together now to develop a training calendar and resources for the next 6 months and beyond. So very timely, Diana. I think that would be great if you want to pursue that. That would be excellent. And Shay's going to help you. Excellent. And the others of you, if you want to help out, Diana, maybe put her email in there somewhere, Diana. Shay, you might want to put your email in there also. You can also find them
They are
on
in
the
there.
website. Okay, great,
Yeah.
great. Excellent. We have 5 minutes left. Any other comments, questions, suggestions? Thank you again to chronic disease. Elba, maybe you want to make a presentation specifically on comadres sometime. Let us know. I think people would be interested in that. You recall that we did have a session not too long ago with the cervical cancer prevention group, where they talked about how important it is to prevent because the treatment is there. People should not be dying of cervical cancer in New Mexico. Any other comments, questions? Yes, and thank you, Cheryl, too. Remember, Cheryl's heading up which committee are you heading up, Cheryl? Heart disease, stroke?
Yes, heart disease and stroke.
Yes, and I know that's a priority for some of you health councils out there, so let's work together on those issues too. Anything else, folks? No? Oh, I have a couple of upcoming announcements. Hang on a second. Let me find that. Share our screen here. We have, well, come on. We have our next Health Council talk is going to debrief the session, what was accomplished in terms of public health in the session. So join us. Hopefully there will be good news in that debrief. So that'll be Fridays, the St. Patrick's Day, wear green from November to noon to 1, sorry. And then we have our next training coming up on community rebuilding, sponsored by the CDC grant. All of you health councils and anybody actually is invited to that Monday, March 6th from 1 to 3. You are welcome to come to our Alliance board meeting. The next one is Wednesday, March 15th from noon to 1. And all this information is on our website. So come join us for any and all of those events. Any last minute announcements from anybody? Nope. Well, again, thank you, team from Chronic Disease Council, for getting us initiating, as I said, this great conversation. And all of you stay in touch. The recording will be available. Notes will be available sometime soon, probably next week, early next week. So let us know. In the meantime, if you have any questions, and Chronic Disease Council, you're going to send us a copy of that presentation so we can make that available also. Yes?
Yes, I can email it to you if that would work.
Okay, that will work. Yes, thank you. Okay, thank you all for coming. Have a great weekend. Take care of yourselves. Continue to do the excellent work you are doing all over the state. Thank you.